Hey guys, be sure to watch the video till the end so you can have a look at the whole procedure of how you get the gastric balloon in your tummy, yeah? From the moment you swallow it to when it settles in your tummy, and how it gets inflated. And yeah, the institution has various procedures, not just the gastric balloon. As you can see from the flyer there, they have so many procedures. So I will input the number at the end of the video, as well as down at the description box, so you can call them to inquire about any other procedure you might have in mind, guys. So enjoy the video, and be sure to subscribe, like, share to as many people as possible. Hello beautiful people, it's yet another day, another vlog, another very interesting vlog, yeah? Today I am joined by Dr. Iqbal.
Asante sana.
Thank you for having us. This is Tuongee Family on YouTube, and we'd like you to shed more light in regards to this balloon, yeah? You can just shortly introduce yourself and the institution, where you're located, and then we can proceed.
Okay, fine. So my name is Dr. Iqbal. I'm a gastric balloon specialist based here at Halcyon Medical. We are based in Upper Hill in 5th Avenue building. Okay.
Okay. Yeah. So now we've seen a few. Well, we've had two public figures who have had this balloon from your institution, yeah, and most of us have so many questions, like what is it about? Does it burst? How to take care of it? Let's just start with what are the options available for someone who needs to lose weight?
Okay, so in medicine we categorize them into three options. So there's the bariatrics, which is the medical weight loss. We have the cosmetics, which is a plastic surgery, liposuction and such. And then we have the nutritionist and the exercise, which is also part of a medical branch. So those are the three branches.
So you've told us about the three procedures. Today I want us to talk about the gastric balloon. Okay. What is gastric balloon, and when did it start? Has it been there in Kenya maybe? How long have you been doing it? Yeah.
Okay, so the gastric balloon, it's a non-surgical bariatric option, weight loss option. It's been around for many years. And there are different types of balloons. So we have the endoscopic balloon, and then we have the swallowable balloon. So those are the two types of balloons. Endoscopic balloon has been around for a while, but the swallowable balloon is still new in the market, about 5 years now. For us ourselves, we've been doing this for about a year.
A year?
Yes.
The swallowable balloon?
No, in general, we've practiced this for a while, about 5 years, but the swallowable balloon was launched in Kenya last year.
Last year? Yeah. Oh, wow.
We are the ones who actually pioneered the balloon.
Oh, good job, good job. So now the endoscopy balloon, how is the procedure?
Okay, so the difference between the endoscopic and the swallowable balloon is that the endoscopic balloon, we place the balloon using a device called an endoscope. It's a medical device. It's basically a fiber optic cable that goes through the mouth, places the balloon in the stomach.
Now back to the gastric balloon. Since so many people are asking about the gastric balloon, how is the procedure?
Okay, so for the gastric balloon, basically it's a pill. This is the pill. Okay, you swallow this pill with a glass of water.
Wow, it's not a big one.
Yes, it looks big here, but then once it contacts the saliva, it becomes soft and slippery, so it's very easy to swallow.
Oh, okay.
Okay, and we, on top of that, we also give you some medication that will reduce, the gag reflex or the feeling like vomiting because of the pill.
Yeah.
So it's very easy to swallow. We prepare you in advance. We also do a trial swallow before the actual pill.
Oh, okay.
Yeah, so you swallow the pill, and once you swallow the pill, it goes down with the tube. So the tube goes along. Yeah, and then the pill reaches the stomach like so. Once it reaches the stomach, this part of the tube dangles at your mouth like so, and we proceed to fill water, basically medical water, which goes down the tube into the pill which is inside the stomach, and this pill becomes this balloon in 5 minutes.
Oh, it becomes this big.
Yes.
Wow.
So this is the actual balloon. So the whole process is just 5 minutes long.
5 minutes.
Yes, there is no anesthesia, no endoscopy, and of course no surgery involved. Very simple.
Oh, wow. So the stomach is bigger than this size?
Yes, it's actually about twice.
Twice?
Yes, twice that size.
Wow, it's well, okay. The procedure is completely painless.
Yes, it's completely painless. It's just about, you're basically here to drink water. You'll just be drinking water. Everything else, we will be assisting you. So there is nothing much to it.
Because swallowing this thing plus this tube being left outside, it's a bit scary.
Yes, it is scary, but believe you me, it's very doable. And it just takes less than a minute to swallow the thing actually. But then the feeling is the one that takes about 4 minutes.
4 minutes?
Yes.
Wow. So now after the balloon has been filled with the medical water, how is the feeling?
So what you'll feel, it's like drinking like a 500 ml of water. Yeah, when you drink that 500 ml, you feel full. You won't feel the liquid moving around in your stomach. So that's the exact feeling you have with the balloon. You won't really feel the balloon. You'll just feel full.
Full. So throughout when the balloon is in your tummy, you'll always be feeling full.
Yes, you'll be feeling full such that you can eat only small amounts. So you will be able to eat, but smaller portions.
Okay. So that now helps with the weight loss.
Yes, but that is just that is not the main aspect to it. It stimulates what we call appetite suppression, and that is what leads the body will start burning up the fats. Yes, and that is what leads to the weight loss.
Oh, okay. Wow. So, who can have the gastric balloon? Is there age limit, body size? Who can have it?
So currently, anyone above 16, the age of 16 is eligible for the balloon. In terms of, there's a calculation we call BMI. So for the BMI, it has to be about 26, 27, above that figure. Anyone above that qualifies for the balloon. And the other criteria for qualification is someone who has not had abdominal surgeries. Like, someone who has a bariatric surgery would not qualify for the balloon. And then the other thing we look at is like psychiatric conditions. So if a patient has a mental illness, then they don't qualify for the balloon.
Okay. What of someone who had a C-section? Does that disqualify?
No, it does not disqualify them.
Okay. Gender?
Anyone is applicable for the balloon, is eligible. As long as you meet the eligibility criteria, you apply, whether male or female.
Okay. You've told us about the preparations. Maybe what are the preparations before having it? Before now the due date.
Okay, so the idea is it's a whole program. So the program includes the procedure itself. It includes a set of devices that they make the follow-up very easy, and then there's the consultations that are ongoing. So it's the 3 parts of the program that go throughout the 6 months. So now what happens is that there is a preparation before the balloon, which takes about 2 weeks to 1 month, whereby we'll start you off on the program and basically train your body and train your mind in such a state that when you have the balloon, your body won't struggle, because there's a lot of changes after the balloon. So it's just about preparing your body for the balloon. Okay.
Okay.
After the preparation, we do the balloon, which is just some 5 minutes or 20 minutes thing. And then after that, basically we continue following up on you. See how you're doing, if you have challenges, anything. So we keep on following up with you.
Okay.
So the team that follows you up, we have a gastrosurgeon, there's a doctor, there's a psychotherapist, there's a nutritionist, there's a trainer, We also have an on-call nurse, so the team is quite big.
Mm. Oh, wow. So you walk through the journey.
Yes.
How long should one have it?
Okay, so for the time duration, the balloon it auto degrades. Okay, so it automatically exits the body anytime between the 4th month and the 5th month. Okay, so the material here degrades. Yeah, it degrades automatically, releases the fluid, and the rest of the balloon passes out as waste.
Oh,
Yeah,
okay.
so it is automatic.
So after 4 months, you can wake up and you don't have the balloon.
Yes, correct,
Oh,
correct.
okay. What's the maximum weight one can lose?
Okay, so we calculate in terms of percentage. So we calculate about 10% on the bare minimum to about 15% of your total body weight. So if you're starting off at maybe like 170 kilos, you'll have about 35 kilos or even 40 kilos. If you're starting at maybe something like 80 kilos, then you will have maybe about 15 kilos, such things. Yeah. So it depends on your starting weight.
Oh, okay. Now, and is there a possibility of you not losing any weight?
No, it is a possibility, but it's highly unlikely. You might not lose. You might not meet your target, but you will definitely lose weight.
Lose weight,
Yeah,
huh?
with balloon. Yeah. So it all depends. As I said, it's a program. So it depends on your follow up. You still have to do a bit of exercise. Just to keep fit. You do have to do a bit of diet in terms of controlling, having a balanced diet, a healthier diet. So it's all the aspects together, not just the balloon.
Not just the balloon. Now, you've talked about exercising. Now, when you're doing your exercises, is there a possibility of the balloon bursting, or
No.
how do you take care of it?
Okay. So for the balloon bursting, it's highly unlikely. The balloon is made out of something called polyurethane, which is very strong, and it's a very malleable at the same time. As you can see, it's very soft.
Yeah.
So the idea is it can't burst under normal circumstances, no matter which exercise you do. However, we do contraindicate extreme exercises, things like bungee jumping or kickboxing and such. But we actually advocate for exercises even after the balloon.
Okay, so light exercises.
Not
And
really light. You can do anything except for extreme exercise. Yeah.
okay. Sleeping positions.
So the sleeping position, it depends from patient to patient. So for some patients, any position works. Yeah, whichever position they're in will work. But for other patients, you'll find that they're most comfortable maybe on the right or on the left or on the tummy or on the back. So it's just patient to patient. But even if it's uncomfortable for the patient, it's only for the first few days. Maybe for the first 3 days, maximum a week. After that, the balloon adjusts to the stomach and you don't have this discomfort. So the sleeping positions, basically any sleeping positions are
Fine,
okay.
no? Okay. Now, after you've had it, are there any side effects?
Yeah, so initially for the first, you see, for some patients, not all, the balloon takes some time to adjust to the stomach, and your body takes some time to adjust to the balloon. Okay, so in this time you might have a bit of nausea, the general feeling of abdominal discomfort, that feeling of fullness. You can have this for about 3 days, but they keep on subsiding from day one. So maximum maybe like about 3 days up to a week, the side effects have subsided and you're back to normal.
Okay. So,
Additionally, we also give you some medication. We're always following you up throughout. So even as you develop these side effects, we are still with you. We'll be giving you medications to help with the side effects, so you're not alone.
okay, so they can call you anytime.
Yes, they can call us anytime. The team is big, so we'll all be available anytime, even if it's at night or Yeah.
And so after the balloon has been removed, or rather has been, what do you call it? It's out of
Passed
your
out.
body.
Yes.
Can you have it again? Or is
Yes.
there a period of time you need to wait?
Yes, you can, but not immediately. You can have a second balloon. We call it a serial placement. So what happens, we give the stomach a time of about a month for the stomach to recover, and then we can reintroduce a second balloon.
Mm. Okay, so you can have as many until you have your ideal weight.
Yes, you can. You can.
Okay.
But again, it's not about having many balloons, it's about having a lifestyle change. So you see, even with one balloon, if you can have that lifestyle change, my patients keep on losing even after the balloon. So you don't
Oh,
really need
because
a
they're now
second
used
balloon.
to the diet.
Exactly. It's
Ah.
all about the lifestyle.
Okay. Now, if for someone who needs to walk in and have the procedure, what's the cost, like the total cost? Yeah.
So the cost ranges on the balloon types. We have different balloon brands, balloon types. So the cost ranges from about 300 to 600,000 maximum. And then it also depends on your medical assessment. Some people will need lab works, a bit of more follow-up before. So it depends on those factors.
Ah, okay. Wow. Maybe something on the side. What drives you? Why did you settle on these procedures?
So what it is about us, you see, we are a level 4 hospital. So for us, it's not about more about cosmesis. Yes, part of the patients who come to us is for cosmetics. It's just for the aesthetic, the appearance. But then you'll realize weight loss is not just about all aesthetics. There's far more to that. So what drives me is obesity is the one that causes most of these chronic conditions. So it puts you at risk of developing hypertension, diabetes, cholesterol, for women infertility. Yeah, so obesity is the major cause of all these things, but not many people think being obese is fine, which is not.
It's not, yeah.
Yes, it will predispose you. So my drive is to prevent these diseases. Even if you're coming in for cosmesis, we'll still prevent them. And then a majority of my patients actually come due to very high pressures, very high cholesterol, and you realize that they normalize, they're off medication. Some even come with depression because of their physical appearance.
Yeah, sure.
So it's a holistic approach to health, not just losing those kilos. That is the main drive.
Oh, wow. Okay. Uh-huh. Once you have it in the tummy, can you drink hot stuff? Does it get affected by that?
No, not really, but we do recommend not like you can't boiling hot kind of stuff. We don't recommend that. But technically, in terms of temperatures, you can have everything as long as you can hold it in your mouth. It's okay.
It's okay for the balloon.
Yes. Yes.
Wow. Okay. So wow. So this is what is swallowed,
Yes.
and after it get filled with the medical water, it comes to this size,
Yes.
and then you pull this one.
Yes, we gently pull it. It detaches from the balloon, so the balloon remains in the stomach, and the tube comes out.
Ah, okay. And it doesn't spill once you remove this one.
No, it doesn't spill. It has an inlet valve that seals. It seals
Oh,
automatically.
automatically.
Yeah.
Oh, wow.
So,
Do you feel this pipe going up or?
No. So for the pipe, you won't feel it. So this pipe is very tiny for the diameter of the esophagus. So it's very tiny.
Really?
And again,
It looks big.
and again, we will have given you some medications that will reduce all the reflexes.
Ah, okay. Oh, wow. So it's not big, it's swallowable.
Yes.
All right. So, Dr. Iqbal, anything else maybe you need to add?
Okay, so aside from that, now the program is a holistic. So it's as much as you get the balloon, you'll get the whole team. Will be following you up with the consultations. They'll follow you through the 6 months. Yeah. Additionally, you'll get a whole. It's a very advanced program where you get all these devices. So number one device is you'll have this watch which will be tracking everything, your heart rate, your sleeping patterns, everything it will be tracking.
Oh, okay.
And then number two device is this scale. Now this scale is very unique. It captures not only your weight, but it will give you your BMI, your metabolic rate, the fat content in your body. And these devices are linked to your phone, so you can actually see your progress. How are you progressing? How many kilos am I losing? And the app will tell you what is the reason why you're not losing enough weight.
Oh, it will give you the reason why.
It will give you the reason
That's
what is
awesome.
yes, what is wrong, and what you need to do additionally to lose more weight. Now this device, the phone, again, all this data is transmitted to our computer, so the
Oh, so you
follow-up
can
is
follow
seamless.
up.
Yes.
Wow. That's
So we
quite a
follow up.
technology.
You don't need to come back to the clinic. We are measuring your weight and all these things. Everything is done online, and we follow up even online. So you see, wherever the patient is, maybe they're somewhere abroad. So long as they have the devices, they
You
don't
can
need to
follow
come
up
back.
from here.
Yes.
So you can tell someone who's not losing weight correctly,
Yes.
and maybe call them and inquire.
Exactly.
Okay.
So we are constantly monitoring everything from our side.
Okay.
Yeah.
And just the last question: are there a specific foods you should take, or?
No, you can eat anything and everything. Okay, including alcohol, because a lot of my patients have this question. You can do anything and everything. However, we do advocate for a healthier lifestyle, healthier diet options, because as I said, it's a lifestyle change.
It's a lifestyle.
So, yeah.
Wow. Okay, so Daktari, thank you so much for your time. I believe we will be back. They have a lot going on in the institution. I believe we will be back for more of this. And thank you so much for shedding light. I know most people just imagine it's just a balloon. How is it? Is it painful and all? But as you've assured, it's not a painful procedure. Yeah.
Yes.
Okay, so thank you so much, Daktari. And till the next one, guys. Bye-bye.
Okay, asante.